clearly this is a high-risk follicular lymphoma. This is a patient who had early relapse after R-CHOP chemotherapy, and again had a very short remission duration after second-line chemoimmunotherapy. We can look a little bit at the prognostic factors. If we try to glean from this case the FLIPI score, likely a score of 5, age, stage, hemoglobin, extranodal sites, and LDH. We would expect in this situation about a 35% 10-year overall survival. There's another FLIPI categorization called the FLIPI2, which takes into account beta-2 microglobulin and marrow involvement. So she probably had a FLIPI2 score of 4 here, which would have given her about a 20% 5-year overall survival. So both of these are relatively high risk from the start. However, the FLIPI score of FLIPI2 doesn't necessarily drive us to choose one therapy over another. It just gives us a general idea of prognosis. So she had a very appropriate treatment. I suspect R-CHOP was chosen potentially because her disease was behaving badly and she had maybe some symptoms that might have made the treating physician worried about some occult transformation. So she received R-CHOP, but unfortunately had a very short remission after that. Now this patient falls into this progression of disease by 24-month category, and it's been looked at by a number of groups. And really not surprisingly, early progression portends a very poor outcome. An important point from this case is that the treating physician was very diligent and performed a repeat biopsy. So the thing to remember with early progression, there is a high rate of transformation. If you look at the PRIMA data, 37% of the patients who had progression within 1 year actually had evidence of histologic transformation to diffuse large B-cell lymphoma. If we look at the BC Cancer Agency data, these are patients treated after bendamustine rituximab. Those that progressed within 2 years had a 76% rate of histologic transformation. So this is very important in terms of management to make sure you repeatedly biopsy patients with the early relapse. And our practice is, whenever possible, we want to make sure we know what we're dealing with when we are changing from one therapy to another. So this this physician did the right thing, did a biopsy, did not see evidence of early transformation and saw still persistent follicular lymphoma, and went on to a second-line regimen. Now, I think the bigger question I would say in this situation is, should one go with a chemoimmunotherapy-based regimen when you've already had a short remission after prior chemotherapy? And, I think that's a matter of debate. Bendamustine obinutuzumab is an approved approach, particularly for those with rituximab refractory disease. But unfortunately, this patient did not get much of a remission after the bendamustine obinutuzumab strategy.